what about other more kind of pharmacological treatments as well? What if someone's tried everything that we just discussed, all the different approaches, and they still experiencing this intense physical symptoms? What do they do?
Okay, so the main pharmacological treatment for performance anxiety is propranolol. What propranolol does, let me give you some context. When we feel anxious, our body releases stress hormones like adrenaline and noradrenaline. Those hormones bind to the beta receptors. Beta receptors there are three subtypes of beta receptors found in different locations. And beta 1 receptors are mainly found in the heart.
Right.
And blocking those beta 1 receptors will decrease heart rate, will decrease the force of the heart contraction, and all these processes will reduce the heart workload and the blood pressure.
Right.
The beta 2 receptors are found in various tissues, including lungs, liver, and vessels. When we block beta 2 receptors, so it can lead to bronchoconstriction, vasoconstriction, and a reduced glucose release from the liver. And the beta 3 receptors are mainly found in adipose tissue and in the bladder. Its clinical relevance is not well understood. It hasn't been studied in the context of performance anxiety.
I see. Okay.
Beta and propranolol mainly blocks beta 1 and beta 2 receptors, and it has a much lower affinity for the beta 3 receptors.
Just so that I make sure that I'm following through, could you just say that in a simple term as well? So how propranolol reduces those physical symptoms?
In a nutshell, propranolol prevents adrenaline from having its full effect on the body. That means it reduces the physical symptoms of physical manifestations of anxiety,
right,
without affecting psychological thoughts and feeling of worry.
I see. Okay, that's something that I can definitely understand now. And is this an addictive medication? Is it one that we have to take long term, every day? How does it work?
It's not addictive. It's not habit forming. So and for performance anxiety, it's often only taken before the stressful event. Okay. So have to highlight that propranolol is a prescription-only medication here in the UK, yeah. and doses prescribed for performance anxiety are usually quite low, 10, 20 or 40 milligrams, 30 minutes to an hour before the stressful event. Yeah. Doses might escalate up to 40 milligrams 3 times a day, but the exact dose and timing will be determined by the prescriber according to the individual needs and response.
Right, okay. So it's a medication that we can't just take after we start experiencing these physical symptoms. You really need to know your triggers. Right. You need to be familiar with what brings on those physical symptoms and to kind of plan ahead and be prepared. And I suppose that's halfway to try and managing any kind of anxiety, having that mental preparation and also knowing your environment and understanding your triggers as well. So I think that's quite important to say.
Yes, you should be fully aware of what situation trigger your anxiety so you can plan ahead.